we will begin the vaccination of First Nations people over age 60.
Tonight, how Manitoba's Stage 2 vaccine rollout affects First Nations.
We've started with our most remote and isolated communities and are moving inward to the communities that have greater access to healthcare services.
An update on vaccines from First Nations Health Authority in BC.
What you'd be looking for is traditional knowledge, so people that have hunted in that area.
And a plan to protect caribou involves a controversial wolf cull. Good evening. Welcome to APTN National News. I'm Melissa Ridgen. The Manitoba government provided an update today on immunization plans for First Nations people in the province. The announcement included an additional 1,200 doses of the Moderna vaccine for First Nations in Manitoba. Traditional healers and knowledge keepers, including those living off reserve, will now be eligible to get the vaccine. First Nations people currently make up 73% of all active cases in Manitoba, as well as 50% of hospitalizations and 40% of all ICU admissions related to COVID-19, many of whom are younger than the average Manitoban.
In Stage 2 of the province's vaccine rollout plans, when Manitoba begins the vaccination of individuals over age 80, we will begin the vaccination of First Nations people over age 60. If we applied the same 80-year-old cutoff for First Nations people, the result would be that First Nations people would be disadvantaged and would not have the benefit of equitable protection that the vaccine would bring. This will ensure the higher levels of risk experienced by First Nations people at younger ages is adequately addressed.
That BC couple accused of flying to the Yukon and to get an early access to the Moderna vaccine have tested negative for COVID-19. Rodney and Ekaterina Baker traveled to Yukon from BC, breaking the territory's public health rules. They later got vaccinated in the small community of Beaver Creek. The couple have since been charged for failing to self-isolate and failing to follow their signed declaration. The couple's lawyer called the community members this past weekend to inform officials of the negative test results. Well, it's Monday. It's our weekly check-in with doctors about all things COVID. Today we stop in BC, where Dr. Shannon McDonald, Chief Medical Officer with the First Nations Health Authority, joins us. Dr. McDonald, what is the current COVID situation like for BC First Nations?
Hi, Melissa. It's been challenging, shall we say, since the beginning of January. To this point, we have 3,752 cases. That's cumulative for the whole year. And we've got over 900 active cases right now. So it's been very, very busy.
What are the challenges in getting the numbers down for specific to BC First Nations?
What we've seen really obviously was the spike in cases from the end of December until mid to late January. They've just started to come back down now, but a lot of that had to do with people gathering over Christmas. People who really didn't respond well to the direction to stay home and stay away.
I think that's been the case. I've been talking to doctors in Manitoba, Saskatchewan, Alberta, and it sounds like it's the exact same thing in BC. People weren't listening to the distancing requirements and were gathering. So the rollout of the vaccine, what's that looking like in BC?
We've done really well. We have a good partnership with the province, which is very helpful. We have delivered more than 13,000 vaccines in 81 communities.
Wow.
Now we are just waiting for the next delivery of allotment of vaccine. We've been using Moderna because we've started with our most remote and isolated communities and are moving inward to the communities that have greater access to healthcare services. So it's been a challenge. Our logistics guys have been brilliant.
Earning their keep.
Yep.
Well, we have a couple questions from viewers. Somebody has asked, can I still pass on the virus if I've had the vaccine?
The honest answer, Melissa, is we don't know for sure. We do know that the first dose of the vaccine definitely decreases the chance of somebody having serious illness by over 90%. The second dose makes it last even longer. What we don't know yet is whether or not somebody can be colonized. In other words, that the vaccine can take up residence without causing illness. That's being studied, but in the meantime, we're telling people to be very cautious, and even though you're protected, your job is to take care of everybody else at the same time. So continue to mask, continue to distance until we have a large enough proportion of the population immunized that risk goes down.
Somebody else had asked, if you receive the vaccine, do you have to take it every year, or is it one shot is good forever?
Again, we're not too sure. If you think of like the flu vaccine, we get a different flu vaccine every year because the flu changes its clothes, for lack of a better term, becomes a variant flu. We know already that COVID can create variants, that there are at least 3 variants we're following across the world right now. And so far, the vaccines look to be effective against those variants, but we don't know if there are going to be new variants and if we may have to adapt to that by creating a newer vaccine going forward. We're hoping that after a second dose of the mRNA vaccines that people will have a long-lasting immunity, but we don't know yet.
And these vaccines don't cost anything. Everybody gets them for free. That was another one of the questions we had.
That is correct. The Canadian government are the purchasers of the vaccine. They distribute them to the provinces, and ultimately they're distributed down to the level where we can provide them to First Nations on reserve. Regional health authorities in BC are responsible for the off-reserve population, but we work in partnership with them to make sure that people are receiving vaccine in a culturally safe and accessible environment.
Perfect. Well, thank you for taking the time to share your thoughts with us on this and update us on the information or the situation that's going on in BC. Always great to see you, Shannon.
Always great to see you. Well, at least hear you. Thanks, Melissa. Take care.
Bye.
Bye-bye.
We want to hear what you think about how the COVID vaccines are being rolled out in your community. Here's how you can continue the conversation. Send your emails to news@aptn.ca. You can leave a comment on aptnnews.ca. You can also find us on Facebook, Twitter, Instagram, YouTube, and now TikTok. Follow APTN News to join the conversation and see all of our latest stories. In northern British Columbia, a Haisla family is in mourning after their loved one gave birth to a stillborn baby last week. At issue is how the 2-week overdue mother was treated in a hospital at Kitimat, later in an ambulance, and then at a hospital in Terrace, BC. The family believes the baby's death was preventable. Dustin Gaucher is the uncle of Sarah Morrison, who's the grieving mother. Dustin joins us now from Kitimat. Dustin, how is your niece doing? How is your family holding up through this?
It's been really trying time. I had my niece over and I saw her for the first time yesterday and basically just had to hug her for about 5 minutes before she could even speak to me. So it's been very traumatic for the family.
You know, is there any new developments in this? And of course, we did a story on APTN News website, aptnnews.ca. The health officials have said they're looking into it. Is there any developments in this investigation? Have you guys filed a formal complaint? Where are things at?
A lawyer reached out to us and he got in contact with my sister, so they're speaking now. And we haven't filed a formal complaint. We've just been too shattered. Basically, yesterday they came over just to complete one of our death ceremonies that we had to do this.
What type of support has your family had through this obviously trying ordeal?
We've had a lot of support coming from outside the community across Canada, the media support, but other than that, just family, friends.
What's next for your family and for the baby's mom? What's the next steps you guys are looking? Obviously, you can't look too far in the future because of this is a traumatic experience. But is there, with one foot in front of the next, what's happening after?
We're still waiting for the baby to return from the autopsy, and then we're going to have to do a burial and yeah, we're just trying to take it one day at a time right now and try and make sense of all this craziness.
Well, we thank you for taking the time to share that with our audience, and of course our heartfelt condolences go to you and your family.
Thank you very much. And my niece is overwhelmed with the support of all the females coming towards all the word encouragement. It's a blessing that we need right now. So I thank everybody that's reached out.
Kathleen Martin's full story can be found on our website, aptnnews.ca. Well, we need to take a break, but when we come back, an update on the Rodney Levi matter and why prosecutors wouldn't charge police. The New Brunswick Prosecution Office says Rodney Levi wanted to die by suicide by cop in a report that summarizes the statements of 6 witnesses and the 2 officers involved in the call that left Levi dead. Last June, Levi was at a barbecue and became distressed. Police were called. Levi approached an officer with knives and was fatally shot. And a witness in the report, known as Witness 7, who was not at the scene when Levi was killed, told investigators that Levi had spoke of suicide by RCMP. The lawyer representing the family of Rodney Levi said the witness statement is not credible.
They didn't apply, the BI did not apply sufficient diligence to ascertain the credibility of Witness 7, then what does that mean about the rest of their work? Again, not concluding one way or the other, posing the question.
Last week, a Winnipeg police officer was cleared in the shooting death of 16-year-old Aisha Hudson. Today, NDP MP Leah Gazan asked about this during question period. Public Safety Minister Bill Blair provided the answer.
Mr. Speaker, last week, the Independent Investigation Unit of Manitoba cleared the police officer involved in the fatal shooting of 16-year-old Aisha Hudson of any charges. The police officer was not questioned, provided a statement, and that was the end of it. Police violence without consequence in Canada is a norm. Rodney Levi, Chantel Moore, and others, all resulting in deaths. Mr. Speaker, how many deaths of Indigenous people at the hands of police need to happen before this government acts?
Honourable Minister.
I want to thank the member for what is a very important question, and we recognize the importance of transparency and accountability for all police actions. And the relationship between the police and the people they serve has to be predicated on trust, and that trust requires transparency and accountability for all police actions. Mr. Speaker, we've made commitments to bring forward reform on these issues, and we're working with our provincial and territorial partners to ensure that all Canadians can be assured that the police actions will always be accountable to the people they serve.
There's an urgent need to protect caribou in the Northwest Territories as the population of some herds have been reduced up to 80% in the last few years. A number of conservation efforts have been in place over the years, but one pilot program is drawing criticism for being costly and ineffective. Our reporter Charlotte Moore-Jacobs learns the logic behind the controversial aerial wolf cull and why some want it to end. A caution to our audience, this story includes the traditional practice of harvesting, so there will be blood.
Utilizing the back of the animal, so I'm getting length when the grader at the auction house is...
Devin Alaloo is only on his 3rd trapping season, but he's already sharing his knowledge.
Pretty much just respecting the wildlife and making sure that you're not causing more harm to animals. So pretty much every trap that I use is for immediate death, but if I use foothold traps, for example, for wolf, I make sure that I'm on top of my game to check them every day.
This wolf is from one of Alaloo's 3 traps he set near the small community of Detta, a 10-minute drive from Yellowknife by ice road.
Just knowing that I was able to harvest, like all the work put into like killing wolf, it's a lot of work, and it's very time consuming and meticulous on where the wolf has to, like, it's not playing by your rules. But
the fur will fetch him upwards of $750, and the carcass $200 from the NWT's wolf harvesting program. in place to support the traditional economy and attempts to help declining bear and caribou herds. In 30 years, the Bathurst herd has shrunk by 98%. According to the last population survey in 2018, the Bluenose East herd was halved in just 3 years, with only 1,900 caribou left. But Alleloo and conservation groups believe local hunters could play a bigger role in reducing wolf populations and slowing the decline of caribou herds. The Wekwiji Renewable Resource Board, a group responsible for managing the 2 caribou herds in the eastern part of the NWT, is recommending that the territorial government scrap a controversial caribou management program aimed at reducing wolf populations. Last year, the territorial government ran a 1-year aerial wolf cull pilot program where they hired marksmen to shoot wolves from a helicopter.
Based on the success of the pilot project, as well as public concern that we heard, the board then made their decision to recommend discontinuing the aerial removals, but continuing the ground-based harvest to offset that need to help the herd.
Jody Pelosi, executive director of the Resource Board, believes the territorial government's current wolf harvesting program doesn't give enough support to trappers.
It's more appropriate to have the harvest conducted in that way. It's more traditional.
Alleloo agrees. Even with an increased bounty for wolf pelt preparation, there's a lot that goes into hunting on the land.
It's pretty much luck of the draw for hunting wolves. Like, every time that I've gone hunting wolves, like, I've pretty much struck out. But if I'm going just out on the land, it's pretty much, if I see it, I'm going to try and get after it.
Another issue, cost. A little under $60,000 was spent on ground harvest support and incentives proposed by the Resource Board. Local hunters harvested 44 wolves in the caribou management zones. Meanwhile, the aerial cull came with a $320,000 price tag to kill just 36 wolves in the same zone. That works out to be roughly $8,900 a wolf. APTN National News asked the Department of Environment and Natural Resources if that cost seemed high.
I think at the end of the day, the program was effective. We reached our targets. That's going to help the overall program for caribou recovery. So I think, and we stayed within our budget. So I think we're confident that it was a good and effective year for the first year. Back in the 1980s, when they were at the peak of 470,000, the range would expand.
Brett Elkin, Assistant Deputy Minister of Operations, says it was necessary to have the aerial cull to meet targets.
There were some challenges last year. The wolves were located in very difficult positions for a lot of our harvesters to access them. So by 3 months of ground-based, we were only halfway to the targets. So we went to aerial using experienced crews.
So once I have the eye clear, I stick my finger inside of it.
But for Alleloo, he believes that the best way to preserve caribou is to provide more opportunities to the trappers who live on the land.
What you'd be looking for is traditional knowledge. So people that have hunted in that area, like specifically McKay, elders that have been there year after year, even born or growing up there. I think that would be good intel for.
Charlotte Mort-Jacobs, APTN National News, Yellowknife.
Time for another break, but still ahead, saying goodbye to Philip Fable. Welcome back. It's time now for our photo of the day. Harvester Chris Garreau captured this picture of a moose enjoying sunset as he was trekking home after a quick fishing trip. Beautiful lighting there. You can send us what you got. Email your shot to share@aptn.ca, and we'll do our best to get them on the air. Well, Conrad Siwi, former Grand Chief of the Huron-Wendat community of Wendake in Quebec, is making history. He has a new leadership position as head of the SAAQ, the province's automobile insurance board. Siwi served as Wendage's Grand Chief from 2008 until he was unseated in late 2020. He was handpicked for his new position by a council of provincial ministers and is the first representative of a First Nation to head the board of directors of a Quebec Crown corporation. APTN's Nouvelle Nationale asked Dewey if he felt he was being tokenized.
Faut pas penser comme ça. Faut penser strictement à la qualité du service qu'on peut donner. On est extrêmement bien formés, capables. On nous donne juste une opportunité, puis on va la remplir avec succès.
Now let's take a look at tomorrow's weather forecast. Off to the east coast, we got -3 and sunshine for St. John's, 6 and some cloud for Halifax. The Grand River -16 and sunny skies. Coonamarac -19 and sunshine. Saguenay, mix of sun and cloud and -5. Montreal, snow -2. North Bay, sunshine -5 degrees. -7 over in Sault Ste. Marie and sunny skies there. Mix of sun and cloud -4 for Sioux Lookout. Big Trout Lake -6 and snow. Norway House and the Paw both snowing and -5. -11 for God's Lake and some snow expected there too. Mix of sun and cloud for Winnipeg and Brandon, -6 for both of them. +3 in sunshine for Swift Current, -4 and sunny in Saskatoon. -10 in snow for Buffalo Narrows. Para -13 for Stony Rapids and Uranium City. -18 for Fort Chip and Fort McMurray and snow there. Sunshine and -10 for Edmonton, +10 down in Lethbridge. 8 for Vancouver and Victoria with some rain expected there, same with Tofino. Dease Lake -17 and snow, -23 and snow for Fort Nelson. Clear skies, -28 for Dawson City, -39 and clear for Old Grove. -30 and snow for Norman Wells. Wauhee, snow, -25. Lots of clear skies up there. Paulachuck, -29 and clear, -32 for Colville Lake. -26 and snow for Baker Lake. -32 and clear for New Yacht. Igloolik, -32 and clear. Cloud River, -35 and clear. Looks like that warm spell has ended for that part of Nunavut. Well, it's with a heavy heart that we are reporting the loss of a great First Nations warrior. Philip Fable from the Sweetgrass First Nation in Saskatchewan passed away early Sunday morning. Fable was a private in the Canadian Armed Forces during the Second World War. Although First Nations were free from conscription, Fable enlisted at the age of 19. He was deployed to France for the invasion on Juno Beach on D-Day. After the war, he continued fighting for rights of Indigenous veterans. Fable was honored last year with a commemorative portrait that now hangs in the Canadian War Museum in Ottawa. He was 98 years old. Since his passing, condolences for the Fable family have flooded social media, including tweets from Prime Minister Justin Trudeau and AFN National Chief Perry Bellegarde. Well, that is your APTN news to kick off your new week and a new month. Thanks for joining me. I'm Melissa Ridgen. Have a great night.